Hi, hello, welcome to my channel, The White Coat. This is Bhavya. Today's topic conducting system of the heart. The heart is able to contract on its own because it contains a special cardiac muscle tissue that spontaneously forms impulses and transmit them to myocardium to initiate contraction. Simply in one line, the heart that generates impulses that helps for contraction on its own without any nervous system stimulation. Characteristics of cardiac conduction cell: automaticity, ability to initiate an electrical impulse; excitability, ability to respond to an electrical impulse; conductivity, ability to transmit an electrical impulse from one cell to another. Components of conducting system. There are five components. First, sinoatrial node, that is SA node. Second, atrioventricular node, that is AV node. Third, atrioventricular bundle, that is bundle of His. Fourth, left and right branches of bundle. Fifth, subendocardial Purkinje fiber. First of all, how conduction occurs. The impulse are generated from SA node, which is pacemaker of the heart. Here, the atria gets contracted. From SA node, impulse are transmitted to AV node through three internodal pathways. The anterior internodal tract is named as Bachmann, which transmit impulses to left atrium. Middle internodal tract, which is called as Thorel, and the posterior internodal tract, which is called Wenckebach. The AV node picks up the impulse from atria and conducts into bundle of His. From there, left and right branches are arised, and lastly it is transmitted to Purkinje fibers. The papillary muscle contracts first to tighten the cardiac tendency, and then contraction of ventricular muscle takes place. Now let's talk about SA node, that is sinoatrial node, which is located in the walls of right atrium near opening of superior vena cava. There is a special muscle fiber that makes up the structure as a unique. They can continually and rhythmically send impulses without any stimulation of nervous system. The SC node is said to be self-existing. It is also called as a pacemaker of the heart because it generates impulses about 70 impulses per minute and also initiates a contraction of cardiac muscle producing heartbeats. AV node, atrioventricular node. It is smaller compared to SA node. It is located in the lower part of the atrial septum, just above the attachment of septal cusp of tricuspid valve. The AV node conducts the cardiac impulse to ventricles by atrioventricular bundle. It generates 60 impulses per minute. The speed of conduction of cardiac muscle is about 0.11 second. Here, it provides a sufficient of time to atria to empty the blood into the ventricle before ventricle starts contracting. Atrioventricular bundle, which is bundle of His, begins from AV node, crosses the AV ring and enters into inferior membranous part of the interventricular septum that divides into left and right branches of the bundle. The right and left bundle branches. The right branch that passes down the right side of the interventricular septum and then enters into subendocardial space on the right part of the septum. The large part of it continues into the septomarginal tuberculum and reaches the anterior papillary muscle and anterior wall of the ventricle. Its Purkinje fiber then spreads out beneath the endocardium. The left branch, which descends on the left side of the ventricle septum, divides into Purkinje fiber, which are distributed to the septum and left ventricle. Purkinje fiber, they are terminal branches that divides into left and right branches of the bundle of His, and that spreads subendocardial over the septum and reach the ventricular's wall. Let's talk about summary. Firstly, the sinoatrial node. It's a pacemaker and which generates 70 to 80 impulses per minute. Here the atria contracts. Second, the atrioventricular node which generates 40 to 60 impulses per minute that connects the atria to ventricles. Third, the atrioventricular branch, which is bundle of hairs that connects the impulse to interventricular septum, and lastly Purkinje fiber, which generates 15 to 40 impulses per minute. This stimulates the contractile cells of both ventricle, starting at apex and moving superiorly. Now let's talk about atrial supply of conducting system. The whole conducting system of the heart is supplied by right coronary artery, which is RCA, except a part of left branch of the AV bundle, which is supplied by left coronary artery. Mostly in the SA node, 55% is supplied by right coronary artery and 45% is supplied by left circumflex artery. Lastly, let's talk about clinical correlation, conducting system defects. Firstly, the defect or damaging of conducting system causes a cardiac arrhythmias, which is irregular heartbeats. If AV bundle fails to conduct normal impulse, alternation in the rhythmical contraction of ventricle takes place, which is known as arrhythmias. Second, the commonest cause of defective conduction through AV bundle is due to atherosclerosis, which is fat accumulation in the coronary blood vessels. The rapid pulse is said to be tachycardia, slow pulse is said to be bradycardia, and the irregular pulse is said to be arrhythmias. I hope you guys have got some useful information from me today. Thank you for watching. Stay tuned for next interesting video.